As we continue to observe Breast Cancer Awareness Month, we take this time to remember and honor the brave warriors who have fought the battle and remember those we have lost. This morning, we continue the conversation on breast cancer awareness with Nurse Joanna Bethel Chambers and Dr. Sunitha Dia. Good morning and welcome to Bahamas at Sunrise.
Good morning. Thank you for having us.
Thank you for being here.
Thank you for having us.
Yes, a very important discussion. I love the pink. I didn't get the memo today, right?
Okay, try and fit in.
I know, right?
Yeah, it's that month.
Exactly. Tell us, why is Breast Cancer Month so important?
Well, Breast Cancer Month is so important, especially for us in the Bahamas, because we have such a high incidence rate of females, in particular, being affected by breast cancer. And that beckons for us to increase the awareness for prevention measures, for women to be more aware, as well as men, because we also have male breast cancer. So we want to encourage the knowledge base, we want to increase that, and increase the prevention measures that can be put in place to help us curtail the statistics against the increase in breast cancer in the Bahamas.
Let's talk a little bit more about early detection. What does that mean specifically for breast cancer, and what is the prognosis once you've had an early diagnosis?
Yeah, once you have the early diagnosis, so there is a 5-year survival rate is 99%. So with once the stages increases, so survival rate also comes down. So early detection is the key point here.
At what age should we be beginning screening for both men and women for breast cancer?
No, actually, every woman need to start self breast examination from 20 years onwards.
20 years.
So it's all depends upon the high risk category and general category. General category, they need to start from 40 years onwards every year. And for high risk category, depending upon they might start at 30 years of age or 10 years earlier than the youngest relative who was diagnosed with the breast cancer.
Yeah, know your family background, know your genetic history, your family history. How many close family members do you have that you know have been diagnosed with breast cancer?
Yeah.
And to be honest with you, we used to think it was an old lady's, no offense ladies, but thought it was an old lady's kind of illness, where we only started screening usually after 50, after you reach 50 years of age and beyond. Now, as Doc mentioned, you have to start screening from younger, because you're realizing the cases are creeping in as we get from the younger age in the 20s and the 30s. So before you hit 40, you really should start your screening in truth.
Yeah.
What are some of the common signs and symptoms you should look out for as a woman does her self-examination?
Yeah, once she need to look for is there any new onset of lumps in not only in the breast, and she has to check in the axilla, means armpit. So, and also, is there any abnormal discharge from the nipple, or any retraction of the nipple, or any skin changes in the breast tissue, means any redness or any thickening of the skin or something? They have to observe all those things.
Have you found that women have been responding to the awareness campaigns, to the early detection campaigns? Are we seeing more women being detected or diagnosed earlier on, and there's a better survival rate for women here in the Bahamas?
Yeah, we have seen some changes because the increase in the awareness programs, like what we're doing now, actually talking about it, getting the word out there, seeing all the campaigns that have happened so far, the Cancer Society, BTC, everybody is going pink for October, so it beckons you to pay attention to the month and what we're trying to bring awareness to, and that's breast cancer. So basically it allows for women to take the time out to check themselves, get their mammograms done like they should have been doing a long time ago, and to make sure that they stay abreast of what's happening currently in research in cancer management. Now, we like to go pink in October, but I want to beckon everyone. Yes, it's nice to be pink and pinkalicious in Pinktober, but we want to make sure that you're also not just being sexy and diva-ish, but you're also getting your actual testing done. It's nice to be fashionable, but get the testing done. Everybody is selling cups and pins and shirts and whatnot. Fine. And it's also even better if they're donating those funds to research to help end breast cancer.
Right. I was going to ask, how can the community continue to support these awareness campaigns? And yes, we wear the pink. We may post on our social media, but it's providing that support amongst your smaller groups. And so maybe there's a small group of you that go on the same day to maybe go get an
They
examination
started
done?
that.
Yeah.
Right.
Fort Terrace Diagnostic Center, I believe, they were advertising like a pink day for bring your girlfriends and
Yes.
everybody just go and get their mammograms done.
Right.
So that could initiate some some changes in how we practice our breast cancer prevention measures
Right.
and not just being fashion. The walkathons, CIBC, I believe, did an excellent walkathon. Monies that are going towards a reasonable cost. Bahari, they donate their funds to reasonable sources that can help us end breast cancer and increase the awareness in the meantime.
Right. And it's important to stay abreast of what's going on. The research is always evolving.
Yes.
There are new treatments and methodologies out there. What do you have to say to maybe someone who's been recently diagnosed with breast cancer? Maybe they're in the early stages. Maybe they're afraid and they don't know what's ahead. What advice or what words do you have to say to them?
Yeah, because actually women, they're scared to go to check their breast. That is very important. They're scared that it is very painful. The main complaint in the regular clinic, I saw that the patients complaining, that is so painful. So I'm not going to this year. So I can go next year or next year. No, that is not. So even though that is a small pain, so we need to check our health and well-being.
And have our men partner with us as well.
Yeah, right.
I spoke about that during Prostate Cancer Awareness Month in September, about females supporting their men and getting their prostate checked. So this time it's our turn, right?
right.
So support us, and not just for your own benefits, but also for the mere fact that you care about us enough that we can live a long, sustained life
Right.
in good health. Yes.
What's the take-home message you want our viewers to walk away with today?
Well, definitely this Breast Cancer Awareness Month, take the time to make the conscious effort to make sure that you are checking yourself. Go and get that mammogram done. I know it's uncomfortable. I know nobody wants to do it, but it's the best way to make sure that you are not having any changes in your breast tissues that you need to identify early. Awareness, catching this thing early is the key. All right, so the early detection is the key.
Yeah, I want to tell especially to the young women, please, all women, they need to start self-breast examination from 20 years onwards.
Yes.
And please know your family history, because BRCA gene prevalence is very high in the Bahamas. So they has to know their family history. And go check out with your doctor, see what is happening, how to screen and everything. So, and also one more thing, healthy lifestyle is very, very important.
Yes.
So cut down your smoking,
Alcohol.
no smoking, not cut down, no smoking, cut down your alcohol, regular exercise, and maintain your weight.
Correct.
Those are important things. So health, regular screening and healthy lifestyle, so it has a great impact on your breast cancer risk and their outcome.
And breastfeeding
So-
our babies is the best.
It's
Yeah.
the best, right?
Yeah.
Yeah,
Breast is best.
breastfeeding,
Breast
yeah.
is best.
Yeah, don't worry, I know about that. I'd like to thank you all again for coming on the show, spreading this important message. If persons wanted to find either of you, maybe for further discussion or to get checked out, where can they find you guys?
But Doc is actually heading to Fleming Street Clinic
Yeah,
today.
I'm going to
Yes.
Fleming Street.
Yes, and she's the OBGYN, so she
There you go.
knows all about female health.
Yeah.
And I'm at the Ministry of Health and Wellness on Meeting Street.
There you go. We'll see you at Fleming Street.
Yeah, see you there.
Thank you so much.
Not you.
No, me. You're right. Thank you again, ladies. Appreciate all
Thank
the work
you.
that you
Thank
do.
Thank
You're
you.
watching Moms at Sunrise. It's still Breast Cancer Awareness Month. Go and get yourself checked out. Men, support your ladies, not just for your benefit, but for the benefit of us all. We'll be right back.